on answering your questions, and we know you have a ton of them. We're turning to the experts. We're going to give you just the facts, not spread the fear. You can send us your questions anytime. Just text us 503-226-5111. And if we don't have a question, for you tonight, we'll keep asking that question until we get you the answers, each and every one of them, every night here at 7 o'clock. And we're going to start with a local attorney with some answers to your legal questions. Let's go to Dana Underhill with Holland & Knight Law Firm. She joins us via live video chat here. Hi, thanks so much for being with us and helping educate our viewers.
Oh, you're welcome, Dan.
Yeah, a lot of people have questions. So President Trump signed the Families First Coronavirus Response Act last night. Can you talk a little bit about what paid sick leave benefits are available in that?
Sure. Yeah, I'd be happy to, Dan. Thanks for having me. So as we talked about last week, this is a rapidly changing scene. And so the leave benefits that we talked about last week are different than the leave benefits that are available now under the new act. So most importantly, for your viewers, the law talks about two key provisions that provide many, but not all, employees who miss work due to the COVID-19 pandemic with access to paid leave under federal law. And that's in addition to or as a complement to the benefits that they may have from their employer and the benefits that may be available under Oregon state law. So there are some complexities to these new laws that are going to continue to require employees and employers to work closely together and to proactively communicate. But let's talk about the key provisions as a starting point. So first, the Emergency Paid Sick Leave Act is a provision of the overall new law that was passed last night. The act provides up to 80 hours of paid sick leave to eligible full-time and also prorated amount to part-time employees. If, and this if is important, if the employer has fewer than 500 employees, if the employee can't work or telework, if the employee is caring for somebody that is either under government or medical quarantine for COVID-19 or are themselves showing symptoms or seeking medical attention, or they're caring for a child that has school closures or childcare closures, which in this world of social distancing we're all facing right now. There are some serious limitations and exclusions in the act that apply to caps on the sick leave amounts that are going to be available to you. But again, it's really important that if you have questions, you speak to your employers, you speak proactively to your employees, and you reach out to the experts who can help you interpret it.
All right, let's elaborate.
So that's number one.
Yeah, that's a big number one. But you kind of touched on some other things we wanted to ask you about here, like schools, for instance, which you were just talking about. They're going to be closed for another 5 weeks here. And so people are asking if their jobs are going to be protected if they have to stay home and take care of their kids.
Yeah, that's an excellent question, Dan. And the answer is, for many, many employees, the answer is yes. So we also have the Emergency Family and Medical Leave Expansion Act. And so that allows employees who are unable to work or telework to take leave due to a need to care for their child as a result of school or daycare closures in light of this public health emergency. And while the first 10 days of leave under that provision could be unpaid, after that, it would be paid under a specific computation. Employees of companies with less than 25 employees may not benefit from this provision of the law. And so that's something that we're looking forward to getting some clarity on.
Yeah, for sure. A lot of the people we're hearing from, because this is so widespread, it's the entire state, we're hearing from so many business owners, small business owners that are trying to stay afloat during this, and they're wondering if their employees if they're able to work remotely, the people they have working for them, do they still have to provide them with sick leave?
Sure. Both of these provisions of the law are written such that they presume that the person who's taking sick leave or who's looking for coverage under the Emergency Family and Medical Leave Expansion Act are unable to work or telework. So that's a presumption that's built right into the law. It's express language within the law.
Dana Underhill, thank you so much. With Holland & Knight Law Firm, we appreciate your insight. Hopefully we talk to you again pretty soon, because I think a lot of people are looking forward to hearing some of the things that people like you have to say, because there are a lot of questions right now. Thanks again, Dana. We want to focus
Thank you, Dan.
You got it. All right, let's get to some more of your questions right now. We've had some of you wondering if you should keep your travel plans. We got spring break coming up, and here's what Dr. Jennifer Vines with Multnomah County Health just said in a news briefing.
I think everyone is worried, and rightfully so. I am worried too. And right now, the best thing everyone can do is use common sense, take care of your needs, but please, please limit your contact with others as much as you possibly can. And that really goes for this upcoming spring break. I would urge people to do a staycation and stay local, stay to your household, keep to your household, and stay with people that you are normally around.
All right, for our next question, we're going to turn to Kim Taves with Multnomah County Health. And we asked, are state and local officials doing enough to limit the spread of coronavirus? She says this is a tough balance to strike.
The very difficult place of balance we're in is trying to make sure that we don't have serious, severe illness and even death happen for our more vulnerable people who can get sick from this disease. And at the same time, we don't want to cause other harms to communities, right? Especially communities of color that have higher burdens of other health conditions anyway, lower income families, right? People who may lose their business. That can have a long-term harm in and of itself that we are not as set up maybe as other countries to mitigate, right? Other countries have a little bit more of a socialism perspective, that they have some resources to give families that we don't quite have here. And so I think that walking that fine line of balance to offset short-term harm, but not actually end up causing like an inequitable long-term harm, is the balance that we're trying to have.
Now, many of you have also been asking about your pets. Well, it doesn't look like pets can catch the coronavirus. There is a way they could pass it on. A viewer wrote us saying, people like to pet his friendly dog named Bo at the dog park. Is that bad? Reporter Nathan Baca with our sister station in Washington, D.C. has that answer.
The CDC says there is no evidence that pets can catch coronavirus, but some veterinarians believe that there is a way they can pass it on. Let's say a person doesn't know they have coronavirus and they have a virus droplet on their hands, and then they pet somebody's dog in a backyard. Now that dog has it on their fur and they can pass it on to their owners inside. And that's why some pet owners are posting signs like these saying, please, no petting.
All right, we're going to turn to Kristen Severance for this next bit, answering some more of your questions.
A viewer wanted to know, does smoking and vaping increase the likelihood of getting sicker from coronavirus? Well, the specific link between smoking and vaping and COVID-19 hasn't been studied or documented yet. But our expert, Dr. Christine Wheeler with PSU, says there's every reason to expect that smokers are more at risk of severe illness with this virus than non-smokers. She says this is based on what we see with the flu and other respiratory infections, as well as what we know about smoking, how smoking affects the respiratory system. She said so now might be a good time to consider, quitting smoking or vaping. All right, next question. If a person feels fine, has no fever or cough, no symptoms, why is there such a rush to be tested? She said 2 words here: asymptomatic transmission. Right now, it seems certain that people who feel fine with no symptoms can be infected and contagious. So anyone who is infected and contagious and asymptomatic, she said this literally could be millions of Americans, is especially dangerous to everyone around them, because neither they nor the people around them are likely to be practicing isolation and other preventative measures. And because of the way this virus is transmitted, she said that person could be infecting everyone within 6 feet of them through the air and everything they touch through direct contact. Scary stuff, so we all really just need to be careful. All right, and next question. A group of my friends were hoping to go for a bike ride. Is that okay? She says in parentheses, if we stay 6 feet apart while riding. So our expert says, one could argue that it could be safe outside in the presence of others if you're 6 feet or more away. But that also means no touching, sharing food, touching each other's bikes, cars. Also, she says, where will this bike ride happen? Where there, are other people going to be around? Many experts are saying that even an activity like that should be postponed. Thank you so much for sending in your questions. We really like answering them, and we will be committed every night, 7 to 7:30, to answering your questions.
Now, coming up, the coronavirus risk that waits in food that isn't cooked properly. Every day we are learning more about this coronavirus. Some research shows now that this disease could start with gastrointestinal problems or GI problems, which is an important development because that could mean you could be at risk if you eat food that isn't properly cooked. Kristen Severance talked today to Dr. Michael Roizen of the Cleveland Clinic, an expert in immunity, about some of the latest developments. He explains how to make sure takeout food is safe.
A virus expert at the University of Pennsylvania, he said that many of the people who had disease symptoms in Korea, Japan, and China first developed what we call GI, gastrointestinal symptoms, including uncomfortable feelings and pain and diarrhea. And so he said, this may be what we call fecal oral transmission. That is, you get it from food as well.
So, doctor, do you think, knowing that information, that takeout food is still safe?
Well, if you reheat it to a high enough degree, Kristen, it is. Food that you get raw, that you cook to high temperatures, that's going to be pretty safe. That's going to be safe. But food that is someone else prepares and then you eat without reheating it to a high enough degree, I'd probably avoid that.
Okay, that's really good information.
All right, some of you have been asking about the symptoms of COVID-19 and when you might actually start feeling sick. For the answers, we turn to Dr. James LeDuc.
So how quickly can a person become symptomatic? We don't have really good data, but the best information we have is that between 2 and 14 days is when people are most likely to become symptomatic.
We've been telling you about the lack of tests available in Oregon. That's slowly changing as the state gets more, but some of you have asked, how long does it take to see the results? Our Kyle Aboshi found out today.
Health officials say they're working as quickly as they can. Generally speaking, in Oregon, patients are having to wait 3 to 4 days to get results. Anything beyond that is due to a backlog. Providence says it's getting results within 24 hours, but that could change as testing increases.
All right, still to come is the coronavirus getting weaker as it's passed from person.
Our Verify inbox is always open. Our team is working around the clock to dispel misinformation about this latest strain of the coronavirus and get you the vetted truth. One viewer noted that the virus can turn into pneumonia in some severe cases. So they asked us this: can a pneumonia vaccine help protect you against the virus? Let's verify. Here are our sources: the World Health Organization, the Harvard Medical School, and the University of Chicago Medicine. All agree getting a pneumonia vaccine is not going to protect you against COVID-19. UChicago tells us that the shot protects you against bacterial pneumonia, not the coronavirus. Emphasis on the virus. Sadly, there's just currently no vaccine to protect against the coronavirus and no medications that are approved to treat it. So we can verify, no, getting a pneumonia vaccine is not going to protect you against the virus, although our experts do say that these vaccines are recommended to protect against other respiratory illnesses.
Another great viewer question here. They ask, is it possible for the virus to get weaker and weaker as it gets spread from person to person? So doctors say the opposite is much more likely. Viruses, while not technically alive, behave in many ways like living things, and that they adapt to their surroundings. This is why we have the flu shot every year, because as flu viruses infect living things all year round, they continually mutate, making themselves better able to live and thrive in our bodies. Doctors say they mutate away from the forms we're immune to, adopting new forms that we aren't. While the COVID-19 virus seems to mutate much less effectively than influenza does, there is always the possibility that it will do so at some point. That is another argument for isolation and containment. Viruses can only mutate to any great extent during an active infection. Fewer infections, fewer opportunities for it to mutate. All right, next viewer question. I keep hearing to leave your windows closed. Is that a serious concern? All right, so the doctor that we've been, consulting with, Dr. Christine Wheeler, said, so far right now it does not appear that the virus would be able to, get into your home through an open window. But again, we are learning, a lot of new things about this every single day. But she said right now she believes it is safe to leave your windows open. And our our next question, is it true that negative test results are faulty up to 50% of the time? All right, so our doctor said false negatives are always possible in any diagnostic test, but no test would be used if it were wrong 50% of the time. The FDA fact sheet on the testing kits being used now says that a false negative result means that there was not viral RNA found in the specimen provided, and they recommend retesting anyone who tests negative for COVID-19, the flu, or other respiratory infections that are also negative. Another reason for a false negative could include maybe a person is in the early stage of the illness with a low viral load. The person's infection could be lower in the lungs where the swab can't reach, and there could be problems with, sample collection and handling or shipping. So much to learn here. I can't thank our doctors and our experts enough for providing these just well thought out answers. We're all in this together and we're all learning together. Please continue to keep sending us your questions.
Thank you to Kristen there. Now, schools are closed right now until April 28th, and many of you are worried about daycares. Our reporter, Christine Pitawanich, talked to one today to find out why they're staying open.
So we're getting this question a lot. Why are daycares staying open? Well, some have closed in an effort to try to prevent the spread of the coronavirus, while others have stayed open. And today I spoke to a woman that works at one of those daycares via video chat. She works at Grandma's Place Early Learning Centers. They've got a couple locations in Portland. She says they're staying open to try to help the families who need to have childcare right now, namely those working on the front lines, like doctors, healthcare workers, even grocery store workers.
They need to feel like their kids are safe and secure so they can go to work.
And Oregon Governor Kate Brown has even emphasized the importance of childcare for those essential workers, especially during this public health crisis.
Thanks, Christine. Here's another question. When is a person considered recovered after contracting the coronavirus? Well, you should be fever and symptom-free for at least 3 days. Or if you can get a test, have 2 negative tests within 24 hours. We're back. We have time for one last answer tonight, and it's not an easy one. How do you talk to your kids about what's going on right now? Clinical psychologist Aziz Ghazipura has some suggestions.
I think this is a great opportunity to educate our children. I think one of the challenges that we're facing right now is that we're having this pandemic and there is a lack of preparation to deal with something at this scale and scope. And there have been people who've been talking about this for many years, saying, hey, if we do this preparation, we'll be ready for something, or more ready. And we have not done a lot of that preparation. And so this is an opportunity to talk openly with everyone, including our children, about these things can happen in life, and how do we deal with them? And I would discuss with children, like, what's happening? It's a virus. What's a virus? It's an opportunity to teach and educate. Now, I might say, well, actually, let's look it up on Wikipedia, because I can give a vague idea, but let's really look at this. And we can help educate them. We can help them learn to deal with what happens in life, and that we're all going to be together there, and we're going to take care of each other. So they can really learn how we can come together in a time of crisis to grow through it together.
Thank you for joining us tonight. KGW is committed to continuing coverage of this coronavirus outbreak. If you still have questions, maybe some of our past stories answered them for you, go straight to kgw.com/facts, not fear. Get up to date on the latest information and our previous reports. Thanks for being with us tonight. As always, keep sending us your questions and we'll keep answering them.